Hi, my name is Angela Echeverry, and I am a core faculty member serving in the inaugural role leading DEIA at our program. I'm here to share more about the Contra Costa Family Medicine Residency Program's work on prioritizing diversity, equity, and inclusion and moving towards anti-racism, also known as DEIA. We have a long-standing history of prioritizing diversity in recruitment for the past 20 years. We worked to clarify our goals and values around DEI and strengthen our commitment to this work in early 2018 to 2019. And that included developing and implementing a DEIA framework to embed across the program. We have a robust Residency Diversity Council that was founded in 2018 and continues to grow and evolve and hold our program accountable to this work. In 2020, with the national reckoning of the murders of George Floyd, Breonna Taylor, Ahmaud Arbery, and many others, with the movement to affirm that Black Lives Matter and to uproot structural racism, all of those historical events provided a critical impetus to deepen this work. The 5 key pillars that form the strong foundation of our DEIA framework include commitment, culture, and climate, recruitment, retention, and the advancement of residents and faculty underrepresented in medicine, curriculum and faculty development, evaluation and assessment, and lastly but importantly, sustainable community engagement. The Residency Diversity Council was founded in 2018 by then resident leader Dr. Jennifer Shrestha. It is a resident-driven leadership council with faculty advisors that are dedicated to improving and sustaining diversity. They have many goals that have evolved across the years. Some of them include building a community of support for URM students, residents, faculty, and staff, important involvement in the active recruitment and retention of URM residents and faculty, increasing our program's visibility through recruitment at regional conferences at LMSA and SNMA, a big focus on actively addressing learning climate and workplace culture issues for URM learners and for all, to really advocate for equity and anti-racism as core values of our program, to promote community engagement and collaboration through health career pathways, and to organize formal and informal didactics that highlight racial inequities in medicine. The RDC has been a strong force that has really helped our program become accountable to the communities and patients that we work with and for. To further deepen this work, our program successfully secured a grant from the Contra Costa Regional Health Foundation that focused on addressing the critical intersection of 2 pandemics, COVID-19 and structural racism. The grant allowed us to focus on hiring an outside consultant, Dr. Sharon Washington, who provided multiple areas of support to deepen our program's work. Some of that included developing the racial literacy foundation of our program leadership and core faculty, enhancing the capacity building of our leadership through leadership coaching. We also used the grant to strengthen community building by prioritizing time and space for the Resident Diversity Council to engage in leadership meetings, to offer URM gatherings for community building, and also anti-racism or racial affinity group caucusing. Some examples of the critical work that our program has developed, implemented, and committed to help deepen the work around DEIA has focused on 4 main areas: community building, capacity building, learning and unlearning, and cultivating a safe and inclusive learning climate and workplace culture. Some examples that have helped around community building include prioritizing time and space for Resident Diversity Council leadership meetings. Also ensuring that there is time and space on a every month basis to have URM and BIPOC or Black, Indigenous, People of Color community gatherings, and also to engage in community engagement or health career pathways work. For capacity building, we worked with Dr. Washington to engage core faculty in a racial literacy intensive over a year to build a strong foundation, as well as faculty development around DEIA. Our focus on learning and unlearning has included an anti-racism library, our longitudinal curriculum called Community Medicine and Population Health, otherwise known as COMPOP, our anti-racism or racial affinity group caucusing, and the Radical series, where we review anti-racism and engage in dialogue. And lastly, in cultivating safe and inclusive learning climates, we have worked on developing and implementing an anonymous reporting tool that is resident centered and have a longitudinal curriculum focused on inclusive communication and the use of a tool to help engage in crucial conversation, to talk and unpack difficult interactions, and to ensure that tough feedback is being delivered. Our program has a longitudinal curriculum called Community Medicine and Population Health, otherwise known as COMPOP. Our curriculum is very mission driven. Our aim is to grow change agents and leaders that provides our residents with a strong foundation in community medicine and population health. It helps us meet our program's mission to train diverse, full spectrum physician leaders who champion health equity in under resourced communities. This longitudinal thread happens every month or every other month during HDC on Tuesday afternoons. We have four main pillars: advocacy and leadership, sustainable community engagement, DEIA, and health equity and population health. Our program has been engaged in sustainable community engagement and health career pathways or pipeline programming work since 2017. We have done this work in partnership with the health system's Health Career Pathways program based out of the Equity Office. Our goals for this work include to grow the next generation of leaders from our local communities across Contra Costa County, to introduce young people to our amazing staff and to expose them to different health careers, to provide young people with potential mentors as they move forward with college and their careers, and to diversify the pipeline of healthcare staff and providers that share in the lived experiences of the patients we work with and for. The critical work and deep roots of DEIA at the Contra Costa Family Medicine Residency Program is a result of the tireless commitment, energy, and labor of champions of residents, faculty, staff, and leadership, and especially from the hard work and efforts of the Residency Diversity Council, who has definitely held us accountable and provided a strong and robust commitment to this work. This has also happened in synergy and alignment with our health system, especially with strong support and partnership with the Equity Office. We hope that you join us in helping to continue to move this work forward.